Thank you.
The news day continues here on One News Now. I'm Riza Diaz. Experts note that the 24 reported deaths after COVID-19 vaccination are not directly linked to the vaccine. This as they continue to urge the public to get vaccinated once supplies come in. Let's get more details. We have Faith Del Mundo. She's joining us live from Quezon City. Faith, how many adverse effects were reported from the vaccine?
Yes, Risa, since the country began its vaccine rollout, there is no recorded adverse effects from the jab so far. However, health experts noted that the 24 people who died after getting vaccinated was not due to the vaccine. In today's Laging Handa public briefing, Philippine Foundation for Vaccination Executive Director Lulu Bravo said that no reports of adverse effects from the vaccine was a welcome development. Dr. Bravo notes that adverse events will likely surface within a month after vaccination. She also clarified that the deaths of 24 people after vaccinations were not directly linked to the vaccine. They may likely have contracted the virus even before getting inoculated. On the reported blood clots from the J&J vaccine, Bravo notes that there is 1 out of 1 million reported case of the adverse effect. She also explained that a further study is needed to know the effects of mixing different vaccine brands, as many factors have to be considered. Risa, in celebration of the World Immunization Week, health experts continue to appeal to the public to get vaccinated as soon as supplies come in. Risa?
Thank you for that report. That's Faith Del Mundo reporting live from Quezon City. Meanwhile, the Food and Drug Administration also maintains that the benefits gleaned from vaccines still outweigh the risks. FDA Director General Eric Domingo says most of post-vaccination deaths had pre-existing illnesses. 11 out of the 24 had contracted COVID-19. 8 had cardiovascular or cerebrovascular diseases, and 3 died from other infectious diseases. Now, 2 cases are still pending for review. Of these fatalities, 10 have received coronavac shots, while 14 had been inoculated with the AstraZeneca jabs. Now, how do experts explain the side effects of COVID-19 vaccination? Let's watch this episode of the World Health Organization's Science in 5, wherein Canadian vaccinologist Dr. Catherine O'Brien gives us her insights.
So, Kate, when anyone goes for vaccination, they may be wondering about side effects. How do experts understand the risks of these vaccines, and how would you explain it, these side effects that you're seeing? How would you explain that to the public?
There's a method to look for common side effects in the clinical trials, and then rare side effects, which are constantly surveyed for in the routine use of vaccines. One of the things that I think people are concerned about is a lot of information in the media recently about blood clots. And this is a topic that the WHO is looking at carefully, regulators in Europe and around the world are looking at very carefully. We're in the midst of collecting information about these very rare events that seem to be happening in the sort of 1 per million, 10 per million kind of frequency. I think it's important for people to remember that the reason that we're vaccinating is because we're in the midst of a pandemic, and we all have risk of COVID infection and COVID disease that exceeds the risk of these very rare events. Nevertheless, what's important is to assess from a numbers perspective, from a risk perspective, the benefit that vaccines confer and the very small risk that these rare events might be associated with vaccines. So both regulators and policymakers are looking very carefully at these data, understanding why they're occurring, where they're occurring, in whom they're occurring, and trying to identify whether there are specific groups of people who are at more risk for some of these events, which it doesn't seem to be, and balancing that very rare and low risk against the benefit of protection against COVID disease. People around the world are working together to make sure that information from anywhere in the world is actually collected together and informs our understanding of both risk and benefit. There are regulators in every country, and there are policymakers in every country. And there is a system where information is shared up through these regulatory committees and on to WHO, where we also have an external expert group that looks at safety data that's coming in from all parts of the world. So it is these reviews of the evidence, and as that evidence changes over time, where these expert committees on safety make assessments of the benefit and the risk. In addition to that, we also have policymakers who are equally looking at these data and providing not only within countries, but also at the global level here at WHO through the Strategic Advisory Group of Experts on Immunization, recommendations to countries for that balance of benefit and risk and how to minimize any risks that might otherwise be present.
We'll be back with more stories after the break. Keep it here on One News. You're still watching One News Now. I'm Riza Diaz. The Quezon City government has issued a set of guidelines for community pantries to guarantee strict enforcement of minimum health protocols. Mayor Joy Belmonte is urging for a written notice to the barangay where the pantry is located, indicating the person responsible for its operation. No barangay permit or clearance will be required for the operation of the community pantry as long as it provides food to the public for free. Pantry organizers and their respective barangays may also coordinate regarding reasonable crowd control measures. The Quezon City government has also ramped its COVID-19 testing and contact tracing efforts amid the boom of community pantries. Mayor Joy Belmonte noted that around 130 community pantries have been established in the city, which could potentially be super spreaders venues for COVID-19. The city has already confirmed over 74,000 COVID-19 cases, nearly 12,000 of which are still active. With this, Belmonte plans on drastically increasing increasing testing to find the infections at the soonest possible time and then isolate them.
Yes, definitely, it's a super spreader event. If there is such a thing here of that nature, and people were really very close to one another. They were spending far too long a time together when they shouldn't. So yes, it's a super spreader event.
Now, here are other stories we're keeping our eyes on. Senator Laila de Lima is now in stable condition after being rushed to the Manila Doctors Hospital for a possible mild stroke. The doctor recommended her to undergo an MRI procedure, and de Lima initially requested for an indefinite medical confinement, but the Muntinlupa court only granted her a 3-day emergency furlough. Former acting socio-economic planning chief Carl Chua is now officially appointed as Secretary of the National Economic Development Authority. Chua pledged to remain committed to the recovery of the economy by fast-tracking the progress of Build, Build, Build program and the implementation of a national ID system. And Bising has now weakened into a severe tropical storm. As of latest data on Friday, Bising's center is located at 825 kilometers northeast of Basco, Batanes. It continues to move out of the Philippine area of responsibility at 15 kilometers per hour. Now, for more updates, visit News 5, the Philippine Star, and Business World online. Visit our website, onenews.ph, for more in-depth analysis. You can also catch One News on Signal Play app. Register for a free account now at www.signalplay.com and stream One News live anytime, anywhere. Mask on, wash hands, and stay safe, Philippines. I'm Riza Diaz. We are One News.